generally comfortable with discussing the end-of-life issues such as death or what our last days on earth may be like. But we all need to be more educated on our options that we have when it comes to the end-of-life issues. When I say end-of-life issues and choices, I simply mean a person should have the right to end their life if they are terminally ill. A terminally ill person is someone who has no chance of their diagnosis ever getting better, and they usually only have 6 months left to live. Setting aside religion and beliefs, I believe every person should have the right to choose if they would like to have a physician assist in ending their life. A person shouldn't have to suffer until their last days without any options or without being able to explore any other options. As stated on deathwithdignity.org, the Death with Dignity Act is currently illegal in most of the United States, except for California, Colorado, District of Columbia, Hawaii, Oregon, Vermont, and Washington. The Death with Dignity Act allows a terminally ill person to make a request to their doctor for a prescription that will ultimately end their life. Of course, the person can't just ask for this because they're feeling down or they're depressed. They have to go through tests to make sure these aren't any of the reasons. In order for a person to obtain this kind of prescription, they must live in one of the states that it is legal, and they have to go through a process. The process includes an oral statement, a written request to their doctor, a waiting period between both, and then they will be evaluated by their doctors to make sure they're terminally ill, they're not just depressed. Then they'll finally get their prescription. Even after all this, the person can choose to take the prescription or not. However, the people who have chosen this option say they feel at peace knowing they have the option, if they do choose to take the prescription, that they will die in peace. According to Procon.com, the states that do not allow physician-assisted suicide are seeing increasing numbers of cases where patients are choosing to stop eating and stop drinking, or they're being sedated to unconsciousness to ease their pain and suffering toward the end of their life. The HastingsCenter.org says physician-assisted death is the very last option when all other pain management has failed and all other options have been explored. A person must be able to mentally and physically make the decision without any help, and they must be able to physically give themselves the pill and take it on their own. I always think of a person suffering until they finally pass and not being able to tell their nurse, doctor, or family member if they need anything, if they're suffering, if they're in pain. And I believe that every person should at least have this option. Some people find out they're terminally ill and decide to move to a state that does allow them to die with dignity and have a physician give them this prescription, when it should be allowed in their home state instead of them having to pack up their entire life and move away toward the end of their life. Deathwithdignity.org states that people who have requested to have assisted death gave reasons such as their desire to control their circumstances toward the end of their life, the desire to even die at home, to be around people who love them, and to be able to die with their dignity without someone having to take care of them and feed them, bathe them. I truly believe every single person should have the right to die and the right to choose if they want to continue life or end it with dignity. This option isn't for everyone. It's only for a person who will never get better and when the only other option is dying and having to have doctors and nurses keep them alive and keep them comfortable until they finally do pass. I just want people to have a better understanding and know that there are different options available when it comes to death.